There are no cost controls in anywhere in the bill except for the public option. And there's also no fairness in many places in the bill. To put more money into the private health insurance companies that have made, frankly, a mess of our health system over the last 30 years is a huge mistake. So I think it's going to come down to whether we get the public option or not, and I think the jury's out on that.
Governor, I've got two questions on that public option. Number one, how do we ensure that a public option does not impact the quality of health care? A lot of people wonder and worry about government getting involved in our personal health care and whether or not that is going to make quality suffer, number one. Number two is, what is so expensive? Why do health care costs rise as much as they do? What specifically is driving it? What is so expensive?
Well, the second question is easier to answer than the first. There's two problems for the health care costs. One is the public has an insatiable desire for more, and the two is the private. Unlike most things in America, the private sector does a terrible job controlling costs. The private sector doesn't work well in health care because there's no feedback loop, there's no supply and demand curve that are linked, and the private and health insurance companies simply can't manage as well as the public sector does.
Well, how can you say that health care? How can you say health care was a failure on the private side when, in fact, the best, most effective drugs in this country, in the world, come from this country? So how can you say that the private sector has done a lousy job when, in fact, all of the innovation comes from U.S. companies?
Well, I didn't say that the drug companies have done a lousy job, and I didn't say that innovation is lousy.
Well, who do you mean by the private sector if it's not the drug companies and the
insurance?
You just talking about the insurance companies.
Yeah, the insurance companies do a terrible job because the problem is they're privately owned, so there has to be a significant return on equity, there has to be advertising, there has to be big CEO salaries, and that all comes out of healthcare dollars. That's why healthcare, from the healthcare system's point of view, having private health insurance companies is incredibly inefficient, and that's why you need the private sector. Now look, if you do a survey of Medicare, most people are happy with Medicare. There are no bureaucrats interfering between doctors and patients in Medicare, but there are a lot of bureaucrats interfering between private health insurance companies and patients and doctors. And that is, I think most people are really upset with the private health insurance industry, and that's why we have to let the American people make a choice. We're not going to make them get into a public health care system, but let them choose what they want. And it's time that the special interests in Congress stopped influencing folks to make their choices for them and let the American people choose. If they want a private sector option, that's great. And if they want a public sector option, they ought to be able to have one, just like everybody over 65 does in this country.